As a future doctor and as an informed citizen of this country in general, I do not agree at all with the NHI bill that has just been passed. Healthcare is so crucial in how a country functions because sick people can't work. Nationalizing healthcare has been implemented in many first world countries and has failed miserably. How is it going to work in South Africa, a third world country? Yes, we have to recognize the fact that our healthcare is very unequal and it's collapsing. But something as reckless and risky as nationalizing healthcare is not the magic wand fix that the government is trying to cosplay it as to be. In fact, it's only going to make matters worse because who's going to fund it? Government is claiming that taxpayers are going to contribute towards the funding. They say approximately 1,500 per month is going to have to be paid. And that's ridiculous considering how heavily burdened taxpayers are already. It might be an arbitrary example, but what if I earn 2,000 Rand a month? So you're telling me I'm going to be left with 500 from the NHI deduction?
Essentially, this NHI bill is a response to the fact that healthcare and access to healthcare in South Africa is very, very unequal. It is also based on the constitutional provision that everyone should have access to healthcare in this country. So that's the problem. The NHI bill is an attempted solution to this problem. And how the NHI bill attempts to solve this problem is by moving away from a multi-payer system of healthcare and towards a single-payer system of healthcare. And essentially, the NHI will be like a universal medical aid for all people in South Africa. So instead of you needing to pay a doctor when you need healthcare, when you need medical services, you will instead be a member of this NHI fund, and the fund will pay the hospitals directly. They will enter, or the doctors directly. They will enter into arrangements and agreements for the rates that they will pay to doctors and hospitals and healthcare providers, and you will not have to make the payment as an individual. The fund, the NHI fund, will make that payment.
If you've ever struggled with healthcare, this bill is important to you. It's called the National Health Insurance Bill and it was first tabled in 2019. Our constitution makes it clear that access to proper healthcare is a human right, but that hasn't been the experience for most South Africans. Up till now, if you didn't have medical aid, you would have to go to a public healthcare provider. But what the National Health Insurance will do is cover you as a citizen, even if you don't pay medical aid, for going to private healthcare services. The idea behind the fund is to close the gap between people who have medical aid and people who don't have medical aid. The NHI would cover you when you go to private hospitals, doctors, and specialists. Obviously, this will threaten the business of medical aid schemes, but as most of you know, unless you have comprehensive medical aid, your benefits are either running out before the end of the year or they don't cover what you actually need covered. So I'm not really worried about that. So this was a policy brought forth by the ANC government, so let's see what the DA and EFF have to say about it.
As a South African citizen who just so happens to also be a taxpayer and a civil servant, and a mom whose children are not going to qualify for any of these things that government expects for us to pay, for me, the NHI bill is just concerning. And I will tell you why I say it's concerning. Because government does not have a plan on how they are going to execute all of this, how they are going to make sure that this comes to fruition. All of this is a seamless process. Unfortunately, this is not going to yield desired results. I do not see how that is going to happen without making all the people that are already paying 25% of tax, which is already way too much, looking at the inflation rates of the country at the current moment and how stagnant salaries are. This honestly does not make sense for us as a country right now. And judging from the fact that this has actually been in the pipelines for years now,
let's talk about what everyone isn't understanding about the NHI bill. I feel like a lot of the dialogue that I've been hearing around the bill suggests that people who criticize it are either speaking from a position of privilege that they're not acknowledging, or they are very classist in their thinking and the way that they behave. I feel like this dismisses a lot of very valuable and important critiques of the bill, so I want us to get into them really quickly. Firstly, it's just a very poorly written form of legislation. We don't understand the very important aspects of it. Like, firstly, how is the funding model going to work? It's okay for you to tell us that you're going to reallocate some government funds and there's going to be personal income tax involved, but that doesn't answer the core questions of how much is going to be taken from each of these things and how is that going to be tangibly impacting our lives. The legislator nor anyone who's speaking on this matter has tried to address this question. It's just seemed like we're going to figure that out later, which is not how laws should work at all.
Not only that, things like medical aid and private healthcare are going to be redundant. Everyone is going to have to fully depend on the state for healthcare. This is including immigrants. Healthcare is going to be free for everyone. But with the corruption and the historical evidence of how unreliable our government is when it comes to providing for its people, especially when they say we're going to allocate funds towards this cause, we're really in for a disaster. Healthcare professionals are going to flee the country because it also means employment for them is not going to be as beneficial or lucrative. And as we know, one of the biggest problems in hospitals is that the patient to doctor or health professional ratio is so unbalanced. There are so many patients, yet inadequate numbers of doctors or health professionals available to attend to them. We all know the story that in public hospitals, people are waiting in long lines or even dying in these lines.
I'm sure this NHI bill is going to require billions to execute. Billions which the country already does not have, according to what they tell us. And honestly, I foresee a disaster. And that is my opinion. But I do not see how this is going to happen without hurting people who are already in the middle and the lower class. Because likewise, the government takes decisions on our behalf with our monies that we work hard for. And they tell us exactly what it is we're supposed to do with our monies. We don't have enough say. So this is yet again another way of them saying to us, you as the middle class are going to fund this particular idea that we have as government who is corrupt, who constantly mismanages money to see to it that everybody that we are supposed to be taking responsibility for is catered for. At this rate, I'm honestly considering leaving my job and staying at home so that I can benefit from all these things that all these other people are getting for free. All the lower class is getting for free. At this point, I'm jealous, honestly. The NHI bill is actually a good idea, but no, the timing is so imperfect, the resources are not there, and we honestly should not be entertaining this at this particular moment, period.
Secondly, we don't know the kinds of services that it's going to fund and the extent to which it's going to fund those services. That is an important question for us to ask and get an answer to, because it ties back to the funding model and how realistic it is. Like, if you're going to fund all medical treatment for everyone, firstly, how is that going to be financially feasible? And how much tax is that going to take from us regular citizens in order for that to be done? As a consequence, how is it going to impact our lives? We are not being unrealistic or ungrateful for asking very simple practical questions about how this is going to work and not having them answered.
How is this going to change if now everyone is going to depend on the government, quote unquote, on public hospitals? If you can't provide for the subset of people who are accessing public healthcare and you can't guarantee them quality healthcare as you've promised to do so under the Constitution, how do you plan on providing for all the citizens? And that also includes immigrants, any person who's coming into the country. That's what nationalization means. It's honestly a beautiful concept on paper because it's a plausible attempt to mitigate the inequalities that are existing in healthcare, accessing it, quality. It should be that whatever socioeconomic background you come from, you should be able to access quality healthcare. However, South Africa is known even globally for having the most progressive legislature, most progressive laws on paper, but none of them can ever be enforced. We don't have evidence for any of the things that are said on paper because the reality that most South Africans are living are so far from what is being promised on paper in legislature. The NHI bill is only going to reinforce that. But in my opinion, this government has gambled enough with our lives that pushing it as far as healthcare just shows how much they do not have the people in mind.
Now, the first question that many people ask when they hear this is, well, where is the money for this going to come from? And that is a valid question, but the NHI bill does try to shed some light on this and say where they're going to get the funds for this. So firstly, they mention kind of like redistribution of current funding and current government income to be able to fund this NHI fund, but they also do mention that there will be a personal income tax contribution as well as an employer tax contribution to fund this scheme. The second question that a lot of people have when they hear about this is, well, what about my private medical aid? Why do I have to contribute to something if I've got a private medical aid? And the answer to that is that the NHI is aiming to almost completely replace private medical aids. Once implemented, medical aid schemes will no longer be able to offer coverage for services, healthcare services, that are covered by the NHI.
Secondly, this is going to divest funds away from an already broken down public healthcare system and push it into a private healthcare system. Because if the guise of this law is to say that people need equal access to quality healthcare, we can assume that majority of people are going to move towards private sector healthcare, which means that on average, government expenditure is going to be hundreds of billions and in the long term, trillions of rands being pumped into the private healthcare sector, which will only improve it significantly more. And public facilities are either going to stay horrible or they might just get significantly worse. This is a problem because public healthcare, geographically speaking, not even just financially, is significantly more accessible to people than private healthcare. So it is much more available and people have an easier ability to access it, yet we're going to be taking funds away from a system that's already broken.
Now, you can still choose to be a member of a private medical aid scheme, but as the implementation of the bill expands, medical aids will be allowed to cover less and less, and eventually the NHI aims to get to the point where medical aids are only providing like top-up coverage that is for things like maybe cosmetic procedures or like more superfluous things that the NHI is not intending to cover themselves. Now, again, this won't happen immediately. The implementation process will happen gradually, and there's a lot of steps in the process that do need to be figured out. The NHI is going to have to go through a contracting process in which it makes agreements with all of the various hospitals and healthcare service providers and establishes the prices that they're going to be able to pay for various things. So it's going to take a while for this to be fully implemented. For now, you'll be able to stay on your medical aid as is, but again, eventually the goal is to completely replace that, or almost completely. The reason behind this is that in theory, it should make expenditure on healthcare in South Africa as like a whole less, while providing more service to more people, ensuring more equitable access to healthcare, and ensuring that there is not a discrepancy in the quality of treatment people are able to receive based on differences in their income or their wealth. So that's the NHI bill, very briefly summarized. I know a lot of people have a lot of thoughts on this, so I'd love to hear your opinions on the NHI bill and whether you think it's a good idea or a bad idea in the comments. I do also know that a lot of people might agree that the bill is a good idea in theory, but be worried about how exactly it's going to be implemented under the current administration and current government. So let me know if you have any of those sorts of concerns as well. I'd love to hear people's different opinions on this one.
NHI bill has been passed and a lot of rich or middle class black people are like, no, poor people shouldn't be in the same hospitals as, rich people. You guys are political cannibalists. Let me tell you why I say this. A cannibalist is someone that indulges in like the bodies of like human beings, like they eat human beings. But I say that you're political because you don't eat them, but you like that they die. Or you indulge and you're satisfied with the fact that they don't get good health care. And if your criticism of the NHI was, oh, how will the government, handle these funds, being that they weren't able to handle SAA, PRASA, ESCOM, public schools, all that stuff, that would be a very valid criticism. But to say that poor people do not deserve the exceptional healthcare that you get, that's insane.
Additionally, the very premise of the bill is flawed. The idea that everyone should access equal and qualitative healthcare, therefore this bill needs to exist because currently poor people are relegated to dysfunctional facilities in the public healthcare system, and the upper to middle class people are able to access better private healthcare. In theory, sounds good, but the logical conclusion to that is important. It is that we should invest funds into improving the public healthcare facilities. Because the very reason why this disparity exists is because we've managed to mismanage funds. We've managed to essentially fumble the public health system. The consequence of that then becomes that there's this disparity. So logically speaking, the best way to address it is to invest funds into making sure that these public facilities are doing significantly better. And my thought behind that is any amount of money, even if it is R1, that the government is spending on private facilities and private healthcare is R1 that could go towards improving the public healthcare facilities that we as medical students learn from, but also is the most accessible form of healthcare for regular people on the ground. This is really a bill that doesn't answer the question that it's trying to answer, and that is the primary issue. But I guess the most we can do is sit and watch and see if anything valuable comes of it.